Hi, my name is Kaylee, and today I will be talking about dental trauma. So what is dental trauma? Dental trauma is any injury to the mouth, which can include the lips, gums, teeth, jaw, tongue, and any surrounding structure. The most common types of dental trauma are fractured jaws, dental fractures, and soft tissue injuries. Dental trauma typically happens unexpectedly. However, some common causes of dental trauma are car accidents, sudden falls, sports injuries, and in some cases, assault. First, I will be talking about fractured jaws. Fractured jaws can be mild, moderate, and severe and can cause pain and swelling. Fractured jaws can disrupt the alignment of teeth, causing it to look uneven or crooked, and it can cause difficulties for a person to eat or talk. For mild fractured jaw cases, it takes about 4 to 6 weeks to heal, and in that process, they hold the jaw together using wires or bands to immobilize it while it heals. For moderate to severe cases, it can take 3 to 6 months for healing. The treatment for mild to severe jaw fractures include the repositioning and realignment of the jaw using plates and screws throughout a surgical procedure. Next, I will be talking about dental fractures. Dental fractures are any crack or break that disrupt the tooth's structural integrity. Dental fractures cause pain and sensitivity, but once you get it fixed, it should only last for 1 to 2 days after. For minor dental fractures, a simple filling like a composite filling can be done to restore the tooth structure. For extensive dental fractures, a crown is commonly done to restore the tooth, and for deeper extensive dental fractures, a root canal is done to get to the nerve of the tooth and get all of the damage and infection out of the tooth's pulp. For severe cases, an extraction is done, and some people choose to do implants after an extraction to have an aesthetically pleasing mouth and look like your teeth are brand new and nothing even happened. Next, I will be talking about soft tissue injuries. Soft tissue injuries can include abrasions, lacerations, and contusions. Abrasions are superficial cuts or scrapes and typically heal fast. Lacerations are caused by tearing or cutting of the skin and can be mild to severe, which can affect the muscles, the nerves, and even can cause scarring. Contusions are bruises caused by broken blood vessels underneath the skin surface. Common treatments include suturing, graft treatments, and flap procedures done by surgeons and typically take about 1 to 2 weeks to heal. If you play a sport, it's best to wear a mouthguard to protect your teeth and jaw from sudden blows to the face, and that can help prevent any dental fractures or jaw fractures from happening. Wearing a seatbelt while driving is also a very important thing to do and can help prevent lots of injuries while driving. Taking precautions while you're walking is also a good idea, like ensuring that the lights are on, making sure the floors aren't slippery and are free of clutter can also help make sure that dental trauma will not happen. Being cautious of what you're chewing on, like hard, crunchy foods, like chewing on ice or biting your nails, can also play a good factor in preventing dental trauma from happening. So as some of you guys might know, I was involved in a car accident in January and experienced some dental trauma of my own. As you can see, I did experience some swelling of the face and a jaw injury. I could not open my jaw for a couple weeks and I could not see out of my eyes. My eyes did become bloodshot and it took several months for me to heal. I got lots of x-rays done and I did see a chiropractor to help kind of readjust my jaw and help with the swelling process. If you do experience dental trauma, it is best to see a specialist as soon as possible to get the best results of healing and to ensure that whatever issue you're dealing with can be resolved. Thank you so much for watching. If you have any questions, please feel free to reach out. Thank you.